Hi, this is Divya, Assistant Professor, Biomedical Engineering Department in SNS College of Technology. This video is also the continuation of the previous video where we are seeing the series of mammograms, mammography or mammogram. Okay. How are screening and diagnostic mammogram differs? What is the difference between the screening mammogram and diagnostic mammogram? The same machines are used for both type of mammograms. We don't have different types of machines. We have only single machine which is used for both the purpose. Okay, screening and diagnostic mammograms are done in a single machine. Okay, however, diagnostic mammograms takes longer to perform than screening mammogram. Okay, the diagnostic mammogram takes longer time to perform than the screening mammogram, and the total dose of radiation is higher because more X-ray images are needed to obtain views of the breast from several angles. Okay, diagnostic mammogram takes much longer time than the screening mammogram. Why? Because the dosage radiation is very higher because more X-ray the dosage radiation is higher because more X-ray images to be needed to obtain the views of breasts in several angles. In different angles, we have to identify what kind of, whether the cancer cell is present or not, or else what kind of cancer cell it is that. We have to identify that, right? So we need to go for, it will take several time to perform to diagnose the breast, and the dosage of the radiation is also bit higher in diagnostic mammography. The technologist may magnify a suspicious area to produce a detailed picture that can help the doctor make an accurate diagnosis. Okay, the technologist may identify the suspicious area to produce a detailed picture, may identify the area where the cancer cell is present, can make a detailed picture that can help the doctor to make an accurate diagnosis of what is present. Okay, this is what the difference between the screening and the diagnostic mammography. Okay, next is, how should patient prepare for mammography? What should he do, or what should she do? Okay, schedule your mammogram when your breasts are not tender or swollen to help reduce discomfort and get good pictures. Okay, to make a date to the to the doctor when the breast is in a good condition. Okay, it should not have any discomfort. Why? Because the picture should be of very clear, so that we can identify what kind of, where the cancer cell is present and how mass it is, and what kind of cancer cell is that. We have to identify that. So the structure of the breast should be very tender. Okay, next, do not wear deodorants or talcum powders or lotions under your arms or on your breast on the day of the exam. When we are going for a mammogram, we are not supposed to use any deodorants or any talcum powders or any lotions under your arms or in your breast. Why? Because they can appear on the mammogram as a calcium spots. We are not supposed to use these things. Why? Because it can appear as a calcium spots, which will be very difficult to identify what it is, right? Describe any breast symptoms or problems to the technologist performing the exam. describe any symptoms, what kind of the symptoms you have to the technologist who is going to take the mammograph of a patient to perform the exams. Obtain your prior mammogram and make them available to the radiologist. Okay, if they were done at a different locations, this is needed for comparison with your current exams. If the mammogram has been done in another place previously, we have to take the report. Why? Because the comparison of the report is very important. Okay, ask when your results will be available. Do not assume the results. Once we have done the mammogram, we need not come to a judgment that we have or the patient have some type of cancer in breast. It is not. We can have it is not blindly identified. If a mammographic procedure is undertaken, the patient only should be present with cancer. No, it is not. Okay, we can have some other kind of tissue growth or something else like that. Okay, we need not judge blindly that if a patient goes for a mammogram, we have only the cancer cells. That should not be done. Okay, these are the patients should be prepared when the mammograph is going to be undertaken. Thank you.